Hello, my name is Agata Zawisza, and I'm an occupational therapist at Toronto Rehab.
My name is Dr. Eliyas Jeffay, and I'm a neuropsychologist at Toronto Rehab, and we're going to review some tips and tricks to help with assessing cognition in a virtual environment. For today's video, we will be using components of the Roland Universal Dementia Assessment Scale, or the RUDAS, to apply some of these tips. When choosing a standardized cognitive assessment to complete virtually, consider whether the assessment has been validated for virtual use.
The virtual assessment tips and tricks that we will be reviewing today require video capability as well as reliable internet, but if a patient is unable to participate in a video assessment for whatever reason, you can still complete some of the assessments over telephone. You will just need to leave out the visual components we are covering today. It's a good idea to have the patient's telephone number handy in the event of technological or safety concern. We cover this in detail in another video in this series.
It is critical to prepare both yourself and your patient for cognitive testing to ensure your cognitive assessment is as accurate as possible. Here are a few tips to consider. Make sure you have a pen and paper handy and ask your patient to do the same, since you may ask them to draw or write as part of the assessment. Although not required, it is also helpful to ask the patient if they have access to a printer. You should aim for high quality lighting, video, and sound as much as possible. A stable internet connection is also critical, and a hardwired Ethernet connection is typically better than wireless. Before proceeding with your assessment, make sure to check with the patient that you are able to clearly see and hear each other. I suggest asking the patient to have their full screen available for optimal viewing, and you can ask them to close any programs or websites not in use to minimize distractions and optimize bandwidth.
You can apply many of the same tools and approaches that you would use to assess cognition in person to virtual care. There is a lot of information that can be gained by observation, such as your patient's general appearance, any behaviors or distractibility, or changes in their affect throughout the assessment. In addition to informal observation, you can ask the patient to complete various actions or movements to assess components of their cognition, including following instructions, visuospatial orientation, and praxis. For example, consider the visuospatial orientation and praxis components of the RUDAS. You can ask the patient to show you various body parts, such as their right foot, or complete an action that you complete. Prior to asking the patient to complete these movements, consider their physical abilities, their environment, and ensure their camera is properly angled so that you can see their movements. Further cognitive assessment can be completed verbally. Informal conversation with the patient about their daily functioning, ADLs, medication management, IADLs, and leisure activities can also provide important insight into the patient's cognitive abilities. You can also gain a lot of information by asking the patient to answer certain questions, such as assessing orientation by asking for today's date and time, or assessing attention by completing serial 7s. Formal cognitive assessment can also be completed verbally. Consider the memory, judgment, and language components of the RUDAS. You can ask the patient to repeat a list of words to assess immediate and delayed recall. For an assessment of judgment, you can ask the patient what they would do in a certain scenario, such as crossing a busy street without a pedestrian crossing. Language can be assessed by asking the patient to list words in a certain category, such as list as many animals as you can in 1 minute.
Cognitive assessment can also be completed by sharing your screen. Although different video conferencing platforms have different features, most provide the option of sharing your screen. We recommend that you practice sharing your screen prior to using this feature with the patient, and again, have no other files or documents open to minimize the potential of accidentally sharing the wrong document. Screen sharing opens up options for assessing various cognitive domains, including memory. Here are a few examples. Assess visual memory by displaying a detailed image or series of pictures on your screen for a certain amount of time, such as 2 minutes. Once you stop sharing your screen, you can ask the patient to recall various details from the image. This assessment can be taken one step further by asking the patient for both immediate and delayed recall.
If the patient has access to a printer, it may be feasible to email a component of the assessment to the patient prior or during the session. For example, executive function can be assessed by completing an errand planning task. Email the patient components of the assessment, such as a blank schedule, as well as the list of errands. If your patient does not have access to a printer, the list of errands can still be screen shared. However, this eliminates the opportunity for the patient to use various strategies, including crossing off errands as they are completed. In order to obtain the patient's completed work, ask for consent to take a screenshot while the patient holds up their paper to the camera. Alternatively, you can ask the patient to take a picture and email it to you. Encourage your patient to complete this while they are with you in the virtual session to avoid the patient altering their completed work. This can be included in the patient's chart if required.
You can also consider using a document camera to show stimuli or share other tools that cannot be screen shared or emailed to the patient due to copyright. Consider the visual constructional drawing component of the RUDAS, where the patient is shown a cube and is asked to draw the picture exactly as shown. The document camera will allow for the image to be visible on the patient's screen. After the patient has completed the drawing of the cube, you can ask the patient for consent to take a screenshot of their drawing to include it in the patient's chart.
In addition to sharing your screen, you can ask the patient to share theirs. As you guide your patient through the various steps, you can also assess their ability to follow multi-step verbal instruction. And once you can see the patient's screen, you can ask them to complete various tasks, such as finding prices of items online while following various rules, including a maximum spend and specific details pertaining to certain items, such as looking for a specific brand or size. Alternatively, a patient can be asked to navigate through a busy website to find requested information.
In addition to these tips, there are also some helpful resources that guide you through standardized cognitive assessments adapted to a virtual environment. For example, the Montreal Cognitive Assessment, or MoCA, has created a video of their virtual adaptation, which is available on YouTube. The MoCA can also be performed over the telephone. Thanks for watching. We hope you have found this video on virtual cognitive assessments helpful.